And the most easiest way is how to find out the hepatic jaundice. Spleen works good. It delivers bilirubin bind by albumin. The liver tries to fix it, tries to grab it, to catch it, but due to inflammation, due to damage, it still can work. It still binds, and there is no barrier for the bilirubin to go away. But due to inflammation, liver cells become more permeable. Some part of this bilirubin leaks away back to the systemic flow, blood flow. What can you see in the blood test? You may see that the level of bilirubin is much more than 20.5, but the level of indirect and direct bilirubin are both increased. Both fractions are increased. In this case, so you can make a conclusion that this patient has a jaundice due to the damage of the liver. A short review. A normal blood test. 75–80% indirect bilirubin. 20–25 direct bilirubin. If the level of total bilirubin is increased, then you should find out what was the reason. If it is increased by both components, indirect and direct, it's a liver problem. If it is increased due to the increasing of indirect bilirubin, but direct is okay, it's a problem of the blood. It's not a liver or problem. It's not a problem of subliver structures. Maybe total hemolytic anemia. But if the level of total bilirubin is mostly increased by direct bilirubin, it means that the patient has a barrier under the liver. So you should know in your practical work, if a patient has jaundice, you take a blood test for bilirubin total and you take two portions and you find out what portion is increased, both direct or indirect. In this case, if you know what portion is increased, you may go further, investigate and find out the real problem, the real reason of jaundice. That's all.